don't go from Nepal?
Because they usually go.
Most of them or just some of them?
Now they are going, like the trend is
On the rise. So do they go mostly to America or to UK?
So mostly it was US.
US,
and
okay.
UK. Now the trend has been shifted to the Australia.
Australia, okay. I think पीछे हम नज़र आ रहे हैं.
Hello, can you hear us? Omer, can you hear us?
Can you hear us?
Dr. Shamim, not kare if you can hear us.
Yeah, we can hear you.
Okay,
Both of us?
Yes, loud and clear.
Thank you. Should we
So
start?
we are
sir?
going to start the case.
So we have a 30-year-old male patient named Mr. Kosak. He is status post cholecystectomy. He's a known smoker. He left smoking 4 months ago. Currently, he's presented to us with complaints of constipation, bloating for the past 3 weeks.
Okay. So just going to make a start. So we give him sedation.
Right, thank you.
So because he's a young patient, so I would say 2 milligram of midazolam and 2 milligram of things. You use fentanyl or you use, what do you use over there? Fentanyl. Okay, so if you're using fentanyl and midazolam, so give fentanyl first and then give midazolam. Or if you give, because then the sedation is much better, because if you give midazolam first, it blocks all the receptors, so the fentanyl doesn't work as good. Okay. How long do you think you have to wait for the sedation to work?
So it is like 1 minute, like 4 minutes.
Normal, ideally,
Okay.
midazolam 4 minutes.
Okay.
No, but you're not going to wait for 4 minutes. I'm just saying. Time out. Okay. 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 Thank you. So you can start. Yeah. So you just, ठीक है, अभी आपका मुआयना शुरू कर रहे हैं. थोड़ा सा उंगली से पहले मुआयना करेंगे, उसके बाद फिर आपका कैमरा से मुआयना करेंगे. Okay. So the bed height is okay for you, or you want it up or down, or you're okay? Enough? Okay, that's fine. तो बस मुआयना शुरू कर रहे हैं अभी. ठीक है, बस ये जाते हुए थोड़ा सा पेन होता है, उसके बाद अब नहीं होगा. So before we start, put the scope in, you tell the patient that you are going to put the scope in. Okay? Because then he knows that this is the scope is coming in. So just put some slight air, yeah, and then that's it, and then tip up, and then just do a clock, yeah, there it is, and again keep the tip up, and just gently advance, and then slight suck, yeah, that's it, just when, for suction you just have to press and let go, that's it, you don't have to press all completely. Okay, so now you were doing anti-clockwise, and then just advance, just a bit of air, slight air, so that you can see where the lumen is. so now there is a lumen. Okay, so gently advance. That's it. So clockwise, yeah, yeah, that's it. So just an intermittent suction, yeah. Okay, just once, because what happens is when you do lot, then it closes. Then you have to put air in, so that doesn't defeats the purpose. Okay, jelly, jelly.
Yes.
So just stop here. So what I do is, because this point, a patient gets a bit of discomfort. So you warn the patient that there might be a slight pressure feeling, okay, and then you go on.
आपको थोड़ा
थोड़ा सा प्रेशर फीलिंग होगी 1 मिनट के लिए बस. Yeah, that's it. Okay, stop. Okay. अब क्या what you need to do is now see you are at 50 centimeters, and if you look at this, the scope is curved. So what I would do is do clockwise torque, clockwise, and then show me the lumen, move the tip up or down, this, yeah, no, whichever way the lumen is visible. So see where the lumen is visible, and slight air, yeah, that's it. Okay, and now I want you to withdraw with the clockwise torque, no, with the clockwise, and withdraw, slightly withdraw, slightly. So stop. You see it was curved, now it's straightened. Okay, now keep the torque to clockwise, okay, and slowly withdraw again, and then now just put some air and see where you are. The gauze and go. So I think you can relax the torque and see where you are, and just suction a bit. Yeah, that's it. And suction again. Now you can see that the lumen is at the 11 o'clock. Okay, so if it's at the 11 o'clock, so you're doing anti-clockwise, and then slight tip up. That's it. Stop, and now advance a bit. Okay, now that's where he's getting the pain. You see where that's where he's getting. So keep the torque. Okay, keep the torque, and then gently advance with intermittent suction, and just warn the patient that it might be a bit of pressure. थोड़ा सा pressure होगा अभी बस. Just gently advance. Just anti-clockwise. Just a bit of anti. Yeah, that's it. And intermittent suction, and gently advance intermittent suction. Okay, that's it. Okay. सही है. दर्द ज़्यादा हो रहा है कि बहुत ज़्यादा? ओके, बस ये एक बैंड के ऊपर से जा रहे हैं, अभी ये सही हो जाएगा आपका. ओके, सो जस्ट gently advance, and that's it. Stop. Now do the other move. Yeah, just see, put some air in and see where you are, where the lumen is. Okay, so there's the lumen. Okay, so if I do this torque, and if I pull out, see I'm going in. Tip up, more fully up. Okay, and now stop here. Okay, and now put some air in. So what we did was that we did a anti-clockwise torque and we pulled back, so we advanced. Okay, so now the lumen is there, up here. Okay, so now what you can do is you can do anti-clockwise torque, and then see pull out again until you reach this end. Okay, so now you're near the lumen. So just pull the tip away from you, put the tip down. Yeah, that's it. Stop. Just a bit up. Okay, so now you know where the lumen is just there. Okay, so now you can do is look at the lumen and see if you can gently push in, advance in. Clean the lens first. Yeah. Okay, that's it, that's it. सही है? नहीं? Okay, okay, just 1 minute. No, I'll just come on that side. No, it's okay. I'll just come. Okay, let's see. So if you do this, we are here. Now you do tip up, tip up, okay, tip up. So I'm doing this. I'm just pulling out. Tip up, okay. So now I know that I've got 1 to 1. See, if I'm moving my scope, it's moving with it. Okay. So with this torque, now I will advance and do intermittent suction so that I can hook over this. Okay. So hold this here. Hold this here. Yeah. Okay. And then do tip up slightly. So you're away from, yeah. And now intermittent suction and just slightly gently advance and see if you're able to go over that. Tip, yeah. Just intermittent suction, 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 suction. That's it. Okay, okay, hold it here. Now let's see, just clean the lens and see where the lumen is. It's down below. So tip down. That's it. Okay. So now stay here. Okay. Now clean your lens. Okay. Now let's see. You're still at 60, but he was not uncomfortable. Although we've got a loop here, but we can straighten the loop at an appropriate place. Okay. So now just show me the lumen. So it's going downwards. Okay. And then do some suction. Just clean this fluid out. Put some air in so that you can see where the lumen is. Okay, and then with the scope you can do clockwise, anti-clockwise just to make sure where the lumen is. So I think it's at 11 o'clock. So do the tip up. Okay. So it's going there, just underneath. So at this point, you can do is clockwise torque, and then move your arm and do clockwise torque, and then see if you can gently advance. If it's going in easily, not going in easily, then hold, and then withdraw back. See where the lumen is again. There is a lumen. Okay, so anti-clockwise tip up. Yeah, that's it. And now intermittent suction. Okay. Now at this point, you're going to do a clockwise torque. Okay. More clockwise. And then slowly pull back. See where the lumen is. See whether you can see the lumen. Just release the wheel a bit down. Okay. See where the lumen is. Clockwise. But can't see the lumen. So just relax the wheel again, and then let's see we can find the lumen again. And release the torque as well. Okay, so let's see where the lumen is. Just withdraw slightly. Okay, straighten the big wheel. See if you can straighten the big wheel. And then do clockwise, anti-clockwise. Put some air in. And see if you can find the lumen. There. Okay, now tip up. Let's find the lumen first. Just pull back slightly, pull back. That's it. Okay. So now you found the lumen. Okay. Now just put some air in. I just want to see where the lumen is going. Okay, there it is going. Okay. So now clockwise or anti-clockwise, yeah, and then intermittent suction, and just advance slightly. That's it. Okay. Now tip down, and then just keep the scope and the anti-clockwise position. Tip down, yeah, and then slightly back because we want to see. Yeah, that's it. Okay. So now we need to see where the lumen is. So just put some air in gently. Just hold the scope here. Put some air in. Just rotate the scope and see. So tip away from you. That's it. Tip away from you more. Yeah, that's it. So that was the lumen there. Okay. Now so put some air, slight air. Okay. And then tip away from you.
Yes, sir.
Okay, so I'm just gently advance while the tip is away. Just and I just push you through this. Just 1 minute. Okay, so this is a lumen. So I'm doing is I'm tip up. Okay, so I know there is going to be loop here. Okay, so I tell the patient that थोड़ा सा आपको pressure feel होगा बस 1 second. So I just went through the loop. Okay, to this area. And then I clean my lens. And then I see where the lumen is. So to me the lumen looks like it's up. Okay, so clean this area again. Make sure we are in the right place. And that seems to be the lumen. So I went there and I did tip up. Okay, and then I'm slowly withdrawing out, trying to see if we can hook over this. Okay, and if I can't hook over, I slowly pull back and then recheck again. Yeah, so the problem is the prep is not as good, so sometimes you get difficulty. So there it is. Okay, so what happens is now we've got an S loop. What you can do is you can just withdraw slightly and look at the scope guide. So the loop is gone. So loop is almost gone. So what we did was we withdrew slightly and the loop almost went. And now as we withdrew, we became closer to that area. Okay, and then all we have to do is just slowly pull back and then find where the lumen is and then go there. So come on. Okay, so there's so yeah, that's it. So tip up, just a bit more, yeah, and then tip down, and then clockwise, and then tip away. Yeah, just gentle advance. Yeah, clockwise more clockwise. That's it. Just put some air in just so that the lumen is visible. Okay, that's it. Clockwise. That's it. Slightly away. Yeah, that's it. So clockwise more. So just relax the wheel and everything. Relax. So the lumen is at 4 o'clock. Okay, so just relax everything, and that's it. There. Now you can do tip up. Tip up. Okay, keep doing tip up. That's it. Just put some air in. That's it. That's it. That's it. Just keep advancing, and just do intermittent suction here. Intermittent suction. That's it. Just keep advancing. So don't do suction when the mucosa is with you. See, because then it gets stuck. So then now just put some air in and then tip up a bit. Yeah. So the lumen is at 12 o'clock. So gently advance, gently advance, gently advance. Yeah, gently advance. Okay, so what's happening when you are advancing? Is it advancing or not advancing? Not advancing? Okay, when it's not advancing, then stop. Okay, so now if it's not advancing, then do the clockwise torque and then pull out and see if that helps. Okay, so two things you can do, because now the scope is like this, so two things you can do. One is either you can just transmit it onto the shaft. Okay, so you transmit it to the shaft and then this will go away over there. हाँ नहीं नहीं वो नीचे चला गया. Okay, and now see. Now just put some air. That's it. There you are. So just advance, just do a clockwise torque and then gently advance, clockwise torque, gently advance, do a bit, yeah, not that much. Yeah, and then tip should be up because you know the mucosa is now, yeah, now advance. Yeah, now advance. Is it going or not going? Not going? Okay, okay. So what's happening is when you are advancing, there is a loop form here. Okay, so I can do is I can ask them to move the patient to the back. Okay, and then see if that resolves it. Back plate are there. So you hold the scope so that you don't lose the position, and they'll put the patient onto the back. 10 minutes. Okay. We're almost there. Okay. So now you do is do a clockwise. Yeah, and then gently advance and see, and tip up. Yeah, and gently advance. If it's not working, then we stop. Not working? No? Okay. Now you do is you can. The next thing is then we ask the tech to press on the tummy. So just a sigmoid pressure. Okay, start. And then when he's doing the sigmoid pressure, now you gently advance. Gently advance. No? Okay. Okay, so first thing I did was I withdrew the scope because your scope was like this, see? So I just withdrew the scope. So now I got lumen. Now I can do is I can ask them to put some pressure and then I can slowly, gently advance. So they put pressure, I slowly, gently advance the scope. That. बस ख़त्म हो गया आपका. Okay. Okay, so if that doesn't work, you should not be doing it, but you know what I try to do is put some slight stiff. Okay, and then I try again. Pressure again. Okay. Okay, so as soon as I'm through, I ask them to release the pressure and loosen it. Okay, because then I don't want to keep it stiff all the time. And then I know I'm over the almost at the splenic, so I just hook up, and now I'm only going to do is I'm just going to withdraw the scope. Okay, so I'm just withdrawing. While I'm withdrawing, I'm moving my hand. Okay, so withdrawing, and I'm at the cecum, almost at the cecum. So that I can see the cecum now. Okay, there's the cecum. Okay, so what did I do? First thing is when you're in the cecum, now you can do is you can ask the patient to go back. They usually say that transverse colon, if you're struggling, put the patient on the back and then shift them over. Okay. Okay, you can take over. So just we'll see the cecum. Let's have a look at the cecum. Okay, just put some air in. Put some air and that's it. Okay, so yeah, just intermittent suction and go over this. Don't do now. No, not when the mucosa is near you. Do a tip up. Yeah. Now do intermittent suction, and then slightly advance. Slightly. That's it. That's it. You are in. Okay. So what you did was intermittent suction. So what happened is your scope is here, and the cecum is here because you blow air.
Yes.
Okay. So you did intermittent suction. The cecum came near you. You didn't have to do anything. Okay. So now just have a look at the cecum. कितने मिनट आगे? So we haven't found any cause of his constipation and bloating. Although his prep is not good, so maybe 5 minutes. Okay. So that's the appendix. Yeah. Pull out, out, out a bit more. That's it. Okay. That's it. So there's a cecum. Okay. So slowly and gradually start withdrawing. So the thing is, obviously his prep is not that good, and then when you're withdrawing, because your hand comes out here, you just need to make sure your hand moves as well. Because if you do torque from here, it will not work. But if you do torque from here, yeah, 10 centimeters usually. So when you're coming out, I want you to see all of it. See, so you do this. Okay. So because you want to see the whole area, isn't it? So you move a tip up, tip down. Okay. You move the scope so that you've seen all the ends of the bowel. Okay. No, IC junction is we pass through it. This is the IG junction. Yeah, that's it. Yeah. So that's it. So you do a bit of tip up so that you know that you've seen the top, and then yeah, that's it. And then slowly keep on withdrawing, and you do the anti-clockwise, clockwise. Just a bit of movement of the scope so that you've seen all of it. Yeah, that's it. That's it. And then when you're withdrawing, you can do is just press on it once, so that some of the air comes out. Otherwise, it will bloat it, but not too much. Okay, because then you'd have to put air in. Okay, so just once or twice is okay. So slowly withdraw. So that's the suction polyp. So keep on withdrawing. Yeah, that's it. Okay, that's it. Just stop. Stop there. So put some air. Put some air. Stop. Put some air. Okay, I want you to stop and put some air. Keep there. Put some air in. Air. Okay. Why? Because I want you to see the whole of the bowel, isn't it? So if there was any part you thought that I came out too quickly, I couldn't see, then you just stop and go back. Okay. So now you withdraw. Yeah. I know with withdraw you can also do like move by your arm. You can move with this. See, if you use with this, no, you don't have to even do the torque. And just slight air. Keep withdrawing. Yeah, that's it. Slight air. Keep withdrawing. Yeah. Don't forget to move your hand. Okay. So tip up a bit. Yeah. Put some air. Yeah. Clean your lens. Yeah. That's it. Tip up. Okay, that's it. Keep on withdrawing. Keep on withdrawing. Keep on withdrawing. Keep on withdrawing. Okay, stop. Put some air. Yeah, and then keep on withdrawing. Yeah. Stop. Put some air. Keep on withdrawing. And then clockwise, anti-clockwise. Okay, and gentle, because you don't want to miss. So if you're coming out too quickly, you would miss smaller lesions. So just come out gently. How much withdrawal time? You know what the withdrawal time should be?
10 minutes.
More than 6 minutes. Yeah. Normally more than 6 minutes. Or you can take you can do 10 minutes or whatever, but it should not be less than 6. Okay, so keep withdrawing. So almost at the end, I think we are 50. So descending colon. Okay, that's it. Good, good, good. Just clean your lens. Yeah, and keep coming out. Stop. There's a bit of suction. Clean your lens. Put some air in. Just do a bit of tip up and then put some air in. Yeah, that's it. And then keep coming out. So just suction this. So if you see a pool, because when you're withdrawing, the pool is going to come with you. So the quicker, if you get a chance of suctioning it, it's better to suction it. So just put some air. That's it. Tip up. Now keep withdrawing. Keep withdrawing. Keep withdrawing. Keep putting. Yeah. That's it. That's it. Stop. Okay. Put some air. Now I do a bit of bit of clockwise or anti-clockwise torque, and now I suction because that's it. Now I've taken it out. Bit of suction more. See. So what I just did was just put the pool at 6 o'clock and then I suction. Okay. So now put some air. Keep withdrawing. That's it. That's it. Move your hand. Okay, anti-clockwise, clockwise. Put some air in. That's it. That's it. That's it. Okay, clean your lens. Okay, that's it. That's it. Good. Now anti-clockwise. Yeah, that's it. Good. इनकी आवाज़ क्यों आ रही है? आसिम वालों की, फ्लोरो की. Okay, anti-clockwise. Yeah, that's it. Slowly, slowly withdraw. Slowly withdraw. Slowly withdraw. So tip away. That's it. Now anti-clockwise. You know the bowel is moving on the clockwise, so you move anti-clockwise. So yeah, and tip up. Yeah, and now clockwise. You have to go against. So the bowel is moving like this. You go against it. So otherwise you just keep falling out. Okay, so that's. I think we are at almost at the end.
I want to know the like retroflexion.
No, not now. No. So retroflexion when you see the rectum. Okay, so you slowly withdraw. Usually, after 20 centimeters, then you'd be able to see. So just move your wheel and just make sure you've seen this. That's it. And then, yeah. So now you are in the rectum. Just suck this. Yeah. That's it. That's it. That's it. More. Yeah, we're just doing retroflexion. Okay, stop. Okay, so put some air in. Put some air in and pull out slightly. Pull out. So now you are in the rectum. Okay, now with this at 6 o'clock, now you do. Have you done retroflexion before? Yeah. So yeah. So this. Warn the patient. थोड़ा सा आपको pressure होगा, and then 1 minute. I am just going to say. So with this, and then keep this here. Keep this here. Okay. And I want you to do this anti-clockwise, clockwise, and then slightly advance. And more. Tip is up.
Tip is up.
Yeah.
Yes, sir.
Okay.
Yes.
Okay.
Thank you,
So
sir.
tip up,
Yes.
clockwise, and sometimes you find a fold.
Yes.
So just do anti-clockwise, just so that you get off the fold. Okay. But because prep is not good, now here you just blow some air, because sometimes you're not able to see it properly. You want to see it properly. Is there any anal cancer or anything like that? Hemorrhoids. Okay. So what you do is blow some air so that it bloats up a bit.
Yes.
More, and then ask them to take a picture. Okay, and then you let everything go. Just relax everything.
Okay.
You just relax everything. You're back to what you were normal. There you go. Okay. Now just suction the air out so that he doesn't feel uncomfortable, and then gently start to move. So when you are coming out, I want you to slightly put some air in here,
Okay.
so that you see the anal canal as well.
Yeah, okay.
Okay. So because what's happening here? Tip down.
Down.
Yeah. So you see the anal canal as well.
Yes.
So in case there is anything abnormal, you at least had a look at
Okay,
it.
sir. Thank you so much.
Okay.
Sir. milliliters.
Sir, how do you first put in the scope, sir?
Hmm.
With the finger like this or just
No,
straight like this?
just straight like this.
Straight like this.
Huh.
Sir. No need to put finger like
No,
this.
no, no need to put finger like I don't
Then normal?
know. No. Close the finger.